There's a new Senate bill in California that attacks physician autonomy, and the California Medical Association is backing the bill. Make no mistake, this legislation subjects physician decisions to mandatory outside review and creates a legal requirement to follow broad guidelines without regard to the doctor's clinical judgment. Whether you think that Senate Bill 276 may add another 0.5% to immunization coverage or a full 0.7%, this government power grab will result in legal precedent for further decreases in physician autonomy. This bill legally binds physicians' decisions for patients to guidelines created by the CDC, and this opens the door for the guidelines of other agencies to become mandates for your practice. You have to look several moves ahead. First comes a legal authority to deny a physician's decision-making process based on guidelines that may not apply to their patient. Second, when we move to a single payer or Medicare for all system or whatever else may be in store for us, how will that affect physician autonomy with the precedent set forth by Senate Bill 276? If guidelines dictate practice, what will be the need for doctors? Ancillary or allied practitioners can follow the guidelines for less money. Further reduction in primary care doctors will follow, and eventually specialists. Call your board, associations, or any other relevant professional affiliations and demand that they protect your rights to autonomy. This legislation puts your future and that of your colleagues at risk. Don't let this power grab under the guise of public health policy take place without a fight. The writing is on the wall. Reduction in medical costs for services provided by physicians is the end game. That will affect all of us. The pharmaceutical lobbies have a near limitless budget. The insurance lobbies have a near limitless budget. The government writes the rules, both federal and state. If you don't take a stand now, the budget to protect physicians' autonomy will dwindle, and guess who will bear the cost of further reductions in healthcare spending? You know they don't have your best interests in mind, nor the public's, when they cherry-pick statistics. While it's true that the percentage of medical exemptions has tripled, it's moved from 0.2% to 0.7%. And what they fail to mention is that according to the same 2018 CDC report that was published in October, all exemptions have decreased by about 33% over that same time period. And that number is not based on a percentage of percentages. Let me restate that for you. The total of all exemptions actually decreased from around 6,300 to 4,190 over that time period. A very successful improvement that's being misrepresented to you and the public about legislation that's working. The question is why? Why use hyperbole with the numbers? Why mandate oversight over physician decision-making about their patients and then bind them to guidelines by law? What decisions will be next and from which doctors? I know you're busy, but complaining about the law after it's in place won't do the trick. We're all in this together. Take the time to take action to preserve physician autonomy. Think of it like this. They meddled in Medicare management, and I did nothing. They meddled in insurance benefits and reimbursements, and I did nothing. They meddled in primary care decision-making, and I chose to do nothing. When they meddled with the specialists, there were too few left untouched to stop it. Do not be divided in this. Our strength is in unity. So what can you do? Make 3 phone calls and share this information today. You need to call your state assembly person, your state senator, and let them know who you are and tell them to vote no on Senate Bill 276. Call the California Medical Association and demand that they stand up for physician autonomy. Thank you for taking the time to watch and listen. I'm your friend in health, a chiropractor, Dr. Richard Robles. Thank you.